Dr. Sovereign, would you like to introduce Dr. Tenenbaum?
Thank you, and through the chair, it's my pleasure once again this evening to welcome our Associate Medical Officer of Health, Dr. Matthew Tenenbaum, who has once again provided his time this evening to address questions that trustees may have in regards to the COVID-19 situation in particular. Dr. Tenenbaum, I'll turn it over to you for any introductory remarks, and then turn it back to Chair Busuttil for the facilitation of questions.
Thank you. Thank you, Director Sovereign. Thank you, Chair Busuttil, and thank you all trustees and everyone on the call this evening. It's a pleasure to be with you, and unfortunately I can only stay until 7:30, so I am hoping we can make the most of our time together just now. And I know I'm coming to you after speaking as well at your last board meeting and giving a bit of an update about what was changing then. And I can tell you a little bit about what's going on now in relation to what was happening about a month ago. As I'm sure you know, we are now in the midst of a sixth wave of the pandemic. Case numbers have increased, so wastewater signals have increased. There is some evidence that the trend is stabilizing and we have perhaps plateaued in terms of our community level of risk based upon some of the emerging data we have locally, regionally, and provincially. But I come to you during a time when the risk in our community is still high. We know COVID is out there. And even though things feel different now, we are not through the pandemic yet. And we all need to make sure we're thinking about those measures that we all know and are used to practicing that reduce our risk of COVID-19. That means being mindful of where we interact and who we interact with. I've spoken before about the idea of the 3 C's, thinking about closed spaces, crowded places, and close contact scenarios. Those are the scenarios where COVID transmits most easily. And it's those scenarios we need to be extra careful and extra thoughtful about the kinds of things we're practicing, whether it's wearing a good, well-fitting mask, whether it's practicing physical distancing, whether it's limiting the size of our gatherings. Those things have been our bread and butter for the better part of 2 years. And the more chances we have to practice them whenever we can, the more we're going to do to reduce the risk of COVID-19 in our community. We are fortunate that there have been a lot of advances we've made over the past 2 years to reduce the impact of COVID-19. And I will take every chance I get to reiterate the importance of vaccination. Vaccination has transformed this disease into one which, for most people, is going to be less severe, but the risk is still out there. And so we are telling everyone who is not fully vaccinated, whether that's 2 doses, if you're between ages 5 and 11, 3 doses if you're above age 12, and now 4 doses if you're above age 60. Please do go out and get the vaccine doses that are recommended for you. They're going to provide or boost the protection that you have from this virus and make it possible for us to move forward as a community in light of the fact that COVID-19 is still out there. So it is still really important for us to be mindful of the fact that this virus is still present in our community. But fortunately, we have tools at our disposal to reduce our risk in certain higher risk scenarios, and also to provide foundational immune protection through getting all the vaccine doses that are available to us. That's my brief update, but I am happy to take any questions that trustees may have for me this evening.
Thank you. Are there any questions for Trustee Foley?
Thank you, Madam Chair, and through you, Dr. Tenenbaum. Thank you very much for coming out once again. Appreciated. I've just got a couple of questions. You've already answered a couple. Thank you. The children under 5 right now, what percentage of them are in, or how many do we have in hospitals right now, the youngest that can't be vaccinated?
So I don't have the numbers at my fingertips in terms of the number of children locally or provincially who are currently admitted to hospital. I do know that we have seen more children in hospital in this wave than in other waves, in part because COVID-19 is so prevalent. There is a lot of infection out there, and every time you have higher numbers of cases, some fraction of them are always going to be requiring more intensive hospital care. So I don't have that number handy, but of course, people under 5 right now are among those who are vulnerable because to date we have not been able to offer them a vaccine. It's my hope that in the coming weeks, we'll be hearing more about vaccines that are going through Health Canada approval that may be good candidates for this age group. And hopefully in the coming months, we'll have something to offer them that will meet their needs around vaccination.
That's great. Thank you. And just a couple more questions, please. At this point in time, do we have a greater handle on what the long-term effects will be on young children, let's say under the age of 16? Do we have any indication what the, as they call it, the long COVID effects are yet?
So I think in terms of long COVID, I'll be frank and say this is a phenomenon that we're still learning a lot about. And, COVID-19 is one of the most studied diseases in human history. And we've learned a lot about the acute impacts of COVID-19. And we're now learning a lot more about what happens to people after having had an infection and resolving and recovering from that infection. And there has been emerging scientific literature to discuss the fact that some people have persistence of symptoms beyond the time of their infection. And we're still learning about what that means, how common that is, who's at risk, and what's actually going on that might help guide our approach to providing care for people who experience that. I think we're going to have a better understanding of that over the months and years to come. I think we're actually very early on in that understanding. And I think that we'll have a better sense soon about, is this actually one condition? Is it multiple conditions that we're considering together? And what is driving it so that we can make appropriate care decisions for people in our community. In terms of who is at risk, this is something, again, I mentioned we're learning more about, but it does look like people who have had more severe illness when they have acute COVID-19 are at greater risk of having persistent symptoms. People who are older seem to be at greater risk. And there also does seem to be a preponderance towards people who are female having greater risk than people who are male. These are still really early signals, but we are learning more about who is at risk. And the data around children and so-called long COVID is not something that we have that much data on yet, but I expect our understanding will evolve over time.
Thank you very much. And finally, I just want to ask you about what do you feel the impact has been upon the mental health of our youth in this community over the last 24 months or so?
So we know the pandemic has had a significant impact on mental health of children and students, but also, adolescents and adults and people across our community who've been impacted in various ways. There's, of course, been, the direct impact, people becoming sick, people knowing others who are sick, young people in our community who have friends or family members who have gotten quite ill, gone to hospital, or died of COVID-19. Those events have significant traumatic impact upon people in our community. There's been a significant disruption caused by the pandemic, of course, the closure of schools, closure of other settings, the limitations on social interaction and limitations on that growth opportunity of interpersonal development. All of those things have had very significant impacts, and we're going to be dealing with those impacts as a community for years to come, as we really understand what that has meant for children and everyone in our community. And we're going to be feeling that for some time. And we do know it's important to be mindful of that as we try to manage COVID-19 going forward. Again, this disease, this infection is going to be with us. And we need to be thinking about the overall health and well-being needs of children, of adolescents, of adults across our community, recognizing that there's the direct impacts of the virus, but also all the many indirect impacts, including mental health impacts that it's had.
Thank you. I appreciate all your information. Thanks again for coming out.
Thank you.
Are there any further trustee questions? Oh, thank you. Trustee Boy.
Thank you, through you. Thank you so much, as always, for joining us here, Dr. Tenenbaum. I'm curious what we know about repeat infections. So I know someone who's had it 3 times now, and I'm just wondering, does anything change as we look ahead to knowing we might get it? Are symptoms going to be worse? Do we know much about repeat infections?
That's a great question. And repeat infections are something that are becoming more of a topic of conversation for us. And we're learning more about repeat infections in the context of Omicron in this current calendar year. It used to be that we thought of COVID-19 as an infection that you certainly could get it once, and rarely you could get it a second time. That, again, it happened, but it wasn't very common. Unfortunately, when it came to what happened this past winter and the emergence of the Omicron variant in November and December and the spread in January, this has been a variant of the virus that has been able to evade not just some of the vaccine-induced protection, but also some of the protection offered by previous infection. And we saw lots of people who had previously had Delta or Alpha or previous variants getting Omicron. And we are now seeing people who have had Omicron in the January period, for example, getting a repeat infection. It can happen. And it speaks of the fact that when you get COVID-19, you're going to have some immune response to it. You're going to build some immune memory. You're going to get some protection. But it is highly variable, and it's no guarantee that you won't get infected again. The idea that this virus is a one and done is not the case. it is certainly possible that you can get infected more than once, which is why it's still important, whether you've been infected or not, to get all your vaccine doses you're eligible for, and to practice the other measures that we've been recommending for some time, like wearing masks in appropriate settings, physical distancing, staying home when you're ill, etc. This is something that could cause repeat infections in the future. And certainly as the overall number of infections is more common, we are going to see more repeat infections. In terms of whether the actual duration of protection you get following an infection is different and what data we have around that data is still emerging. We think that in the short term, in the weeks that immediately follow an infection, your odds of getting a second infection immediately after is very small. But certainly over time, after about 3 months, certainly, you are at risk again if you aren't practicing those recommended measures that we're talking about tonight. So it happens, it's possible. It's unfortunately more common than it has been in the past, but the measures that protect you against the first infection also protect you against a repeat infection.
Thank you. And through the chair, just to confirm, can we expect more difficult or same as, or is there any science on how that person might react on a second or third infection?
So I don't have hard data that I can point to that can give me exactly what to say on this, but certainly we expect that when you're exposed to a virus and your body has had some previous exposure to that virus and has built some immune memory, we would anticipate that subsequent exposures, if they result in infection and illness, are going to be milder illness. Again, no guarantees. And of course, the virus changes in real time, as we've seen over 2 years. But in general, once you've had some previous immune memory, that immune memory can get activated if you're exposed again. And we would anticipate, all else being equal, it's going to be a milder illness. But again, no guarantees, and the situation does change.
Thank you. Are there any further questions from trustees? Being none, can I have a motion of receipt of the verbal public health update with thanks to Dr. Tenenbaum, Trustee Topping and Trustee Eatboy, all in favor? That carries with thanks. Thank you very much. Thank you.
Thank you.
Thank you. We're going to move to the new item number 11, Program Committee